The helicopter didn't land. It fell. It came down sideways across the rooftop of Northbridge Medical Center with a sound that shook the fillings in people's teeth 3 floors below. And for exactly 4 seconds, every person in that building stopped breathing. Glass trembled in its frames. A ceiling tile dropped in the second-floor break room and hit a coffee mug. Car alarms went off in the parking structure across the street. Inside the hospital, one woman stood completely still while everyone else ran. Her name was Olivia Bennett. And 6 minutes before that helicopter hit the roof, the hospital director had told her she was finished. If you want to know how a woman they threw away became the only person who could save the man they couldn't, stay with me until the end. Follow this channel, hit that like button, and drop a comment telling me what city you're watching from. I want to see how far this story travels. The morning had started the way most of Olivia's mornings started at Northbridge, moving fast, saying little, and making up for everyone else's gaps without letting them know she'd noticed. She had arrived at 6:42, 18 minutes before her shift technically began, because the overnight crew on Ward C had a habit of leaving incomplete handoff notes, and she'd learned that the hard way 2 years ago when a patient's potassium levels went unchecked for 4 hours. Nobody got blamed for it officially. These things rarely produced official blame. They just produced consequences that fell on whoever happened to be holding the chart when something went wrong, and Olivia had been holding that chart, so she'd started coming in early. The hospital itself was a mid-sized facility on the eastern edge of West Haven City, not a flagship trauma center, not a small community clinic, but something in between that tried to function like the former while being funded closer to the latter. The lobby smelled like industrial cleaner and the cafeteria coffee that started brewing at 5 a.m. and sat on the burner until noon. The overhead lights on the second floor had been flickering for 3 weeks. Facilities had a work order in. Nobody held their breath. Olivia liked it anyway, which said something about her. She was 31, brown-haired, with the kind of face that people described as pleasant and then immediately forgot. Not because there was nothing there was plenty if you were paying attention, but because she didn't perform. She didn't smile on cue or make eye contact for longer than necessary. She did her work, she tracked her patients, and she went home. In a building full of people who networked during rounds and laughed loudly in the hallways, she was easy to overlook. That morning, she reviewed the overnight charts on misses. Garland in bed 4 caught a missed note on fluid intake, flagged it for the attending, and was halfway through a patient assessment when Dr. Priya Soni walked past and didn't acknowledge her. That wasn't unusual. Priya was a hospitalist who operated on the principle that nursing staff existed to execute orders, not generate them, and she'd made that clear to Olivia specifically on 3 separate occasions, each phrased differently but meaning the same thing. You are not who I take input from. Olivia had written it in no report. She just adjusted. By 8:15, she was managing 4 patients, had caught a potential drug interaction the overnight pharmacist had flagged incorrectly. The system showed it as resolved, but the correction hadn't been applied, and was explaining to a 67-year-old man named Harold why his discharge paperwork wasn't the same as his discharge, actually, and he'd need to wait for the attending to sign off, which should be within the hour. They told me 9 o'clock, Harold said. I know. I'm going to try to make that happen. My wife's waiting downstairs. I know, Mr. Hayford. I'm on it. She was. She'd already called down to the attending's office. She was also, at that moment, carrying 3 other things in her head simultaneously. The fluid chart on bed 4, a call she needed to return from the lab, and the fact that the IV line on bed 7 was due to be changed. And none of that was visible on her face because she'd long ago stopped letting what was in her head show up on her face. It was a skill she'd developed before nursing school, before West Haven, before a lot of things. She didn't think about that. The summons came at 9:04, not through a page, not through the charge nurse, through Sandra Welk, the director's administrative assistant, who appeared at the entrance toward C in the kind of careful, deliberately neutral expression that people wore when they already knew something you didn't. Director Voss wants to see you, Sandra said. His office, now. Olivia pulled off her gloves. I'm in the middle of a patient round. He said now. Sandra glanced at the floor. I'm sorry, Olivia. That last part landed wrong. You didn't say I'm sorry as a preamble to a scheduling inconvenience. Olivia understood, in the way she'd learned to understand things quickly, that this was not going to be a routine conversation. She told the charge nurse she'd be back, gave a brief handoff on the 2 patients she was actively monitoring, and walked down the hallway toward the administrative wing with her hands loose at her sides. Richard Voss's office was large in the way that institutional offices were large. Not because the person in them needed the space, but because the space was meant to communicate something. A long oak desk that had been purchased to imply permanence, framed commendations on the wall, a window overlooking the parking structure that managed to look impressive anyway because of the angle. Richard was 54, silver-haired. He had the posture of a man who had been told he was decisive so many times he'd started to believe it. He didn't look up when she entered. He waited until she was standing in front of his desk, and then he looked up slowly, which was a power move she'd seen enough times to recognize it and be slightly exhausted by it. "Close the door," he said. She did. There were 2 other people in the room. Marcus Webb, the director of clinical operations, sitting in one of the chairs by the window with a folder open across his knees, and Dr. Elaine Hargrove, the chief of nursing, standing near the bookshelf with the particular stillness of someone who had already decided what they were going to do and was just waiting for the meeting to catch up with their decision. "We've had 3 complaints in the past 6 weeks," Richard said, "regarding your performance." Olivia kept her face neutral. "From whom? That's not something I'm at liberty to discuss." "Okay. What are the complaints?" He opened a folder. He read from it, which told her the complaints had been written down ahead of this meeting, which told her this meeting had been planned. The complaints were failure to communicate adequately with the attending physician team, a documentation irregularity in a patient chart from 3 weeks ago, and she almost asked him to repeat it, creating a disruptive atmosphere on the ward. She looked at him. "I want to understand the documentation irregularity," she said. "Which patient?" "That's being reviewed." "I'd like to know which patient." Marcus shifted in his chair. "Olivia, the purpose of this meeting isn't to relitigate individual incidents. The purpose is to address a pattern. I'm not seeing a pattern in what you've described." "That's part of the concern," Richard said. The room was quiet for a moment. Outside the window, a delivery truck was backing into the loading dock. Olivia knew, with the clarity of someone who had learned to read rooms under conditions considerably more stressful than this one, exactly what was happening. The complaints weren't specific because they weren't meant to be specific. They were meant to be numerous. 3 complaints in 6 weeks sounded like a pattern regardless of their content. That was the architecture of what was being done here. "I've been at this hospital for 4 years," she said. "My patient outcomes are in the top quartile of the nursing staff. I've had 1 formal grievance filed in that time, which was resolved in my favor." "This isn't about your record," Elaine said from the bookshelf, speaking for the first time. "This is about fit. Fit. With the team, with the culture we're trying to build here." Olivia looked at her. "Can you tell me what I've done that doesn't fit?" Elaine didn't answer that. She looked at Richard instead. Richard set the folder down. "We're going to be letting you go, Olivia, effective today. You'll receive your standard severance, and HR will—" "Today," Olivia said. "You're finished here," Richard said. The words came out flat, like he'd said them before in other rooms to other people, and had stopped thinking about what they meant. "I'd ask you to gather your personal items and complete the exit process with HR by noon." She looked at him for a moment, then at Marcus, who was studying his folder, then at Elaine, who was looking at the wall. "All right," she said. She didn't raise her voice. She didn't ask any more questions. She stood up and she left.
Much as a...
The locker room on the 2nd floor was empty at 9:20 in the morning. Everyone was either in rounds or at stations. Olivia appreciated that. She wasn't in the habit of needing an audience, but she especially didn't want one right now. She opened her locker and started putting things in her bag. It wasn't a lot. A spare pair of compression socks, a water bottle, a small notebook she used for tracking things she didn't want to type into the system, a photograph tucked into the corner of the locker door, held in place with a strip of medical tape, old enough that the edges had curled. She took the photograph out and looked at it. 7 people in dusty fatigues, desert background, someone's arm around her shoulder, everyone squinting against the sun. She was the second from the left, and she looked younger, and she looked like a completely different person, and she also looked exactly the same. She put it in her bag. A younger nurse appeared in the doorway. Cass, 23, 3 months on the floor, still in the phase where everything either thrilled or terrified her. Olivia? Cass's voice was careful. Word traveled fast in this building. Is it true? Yeah. That's not right. You're literally the best nurse on the floor. Olivia zipped her bag. Don't let anyone hear you say that. It'll make things weird for you. I don't care. You should. You're 3 months in, Cass. Keep your head down for a while longer. Cass looked like she wanted to argue. She didn't. She stepped aside as Olivia moved toward the door, and then she said quietly, I'm sorry. You didn't do anything. Olivia walked down the hallway toward the HR office, and she was almost there when the building shook. It wasn't an earthquake. It wasn't a gas line. It was a sharp, massive percussion from directly above, metal on concrete, a catastrophic contact sound, followed by a secondary vibration that rolled through the floors and walls like something enormous had just decided to stop moving all at once. Olivia stopped walking. Then the overhead intercom crackled, and the voice that came through wasn't calm. All staff, this is a code silver. I repeat, code silver. All available trauma personnel report to the emergency coordination area immediately. This is not a drill. Code silver. External disaster. Mass casualty potential. Facility impact. Someone started running past her in the hallway. Then 2 more people. A cart clattered somewhere. Olivia stood still for 1 more second. Then she followed. What? The rooftop access was already locked down by the time she reached the stairwell landing. Security personnel in the doorway. Radios crackling. Someone on the phone saying, yes, we have confirmed contact. I need you to tell me how many personnel were on board in the voice of a person who was not getting a good answer. What she could see through the wired glass window in the stairwell door was the underside of a rotor blade. It had come through the edge of the rooftop structure and was hanging at an angle that shouldn't have been structurally possible, which meant the rooftop structure was compromised in a way that hadn't been assessed yet. She moved back down toward the ER. The emergency department at Northbridge was not large. It had 12 bays, a trauma suite, and a corridor that connected to radiology. It was designed for the volume of a mid-sized regional hospital, which meant that on a normal day it functioned adequately, and on a bad day it became a problem very quickly. Today was going to be a bad day. Richard Voss had materialized in the ER, which was both appropriate. He was the director. This was a crisis. And immediately disruptive, because he was the kind of person who, under pressure, needed to be visibly in charge in a way that interfered with the people who actually knew what they were doing. He was standing near the central station issuing directives to the charge nurse, Dr. Tom Bauer, who had the look of a man trying to be polite to someone while also managing the actual emergency happening around him. I want the trauma suite prepped for multiple casualties, Richard was saying. I want all elective procedures halted. We're already on it, Bauer said. I want to be briefed every 5 minutes on incoming. Richard, I will brief you when I have something to brief you on. Right now I need my staff to work. Olivia stepped into the ER and moved to the peripheral edge near the supply carts. She wasn't on staff anymore. She had an HR appointment she was supposed to be completing. She was also, very clearly, in the middle of a mass casualty event at the facility she'd just been removed from, and she was one of the more qualified people in this room, and those 2 facts sat next to each other in an uncomfortable way that she chose not to examine right now. She found a pair of gloves and put them on. The first casualties came through the ambulance bay 8 minutes after the impact. 2 soldiers in tactical gear, alive, moving, walking wounded, one with a field dressing on his left arm that had been applied correctly, which told her something about where they'd come from. A third was on a gurney, head laceration, right shoulder dislocation, conscious and oriented but in significant pain. Behind them, a second gurney. This one was different. The man on it was large, easily 6'2", broad through the chest, the kind of physical presence that read even in a hospital gown. He was in tactical clothing that had been partially cut away, and there were 2 field dressings already on him, one to the left side of his torso and one near his right thigh, and both were saturated. An EMT was manually maintaining pressure on the torso wound while a second was running a bag. His face was gray, He was conscious. Barely. His eyes moved. They tracked. And then, with what looked like significant effort, his hand came up from the gurney and caught the sleeve of Dr. Bauer, who was moving alongside the gurney, and the grip stopped Bauer mid-stride. "Hey," Bauer looked down. The man's lips moved. Bauer leaned in. The ER was loud. Monitors, voices, equipment clattering. But the room had developed the particular acoustic quality of a space where everyone is trying to listen to one thing without looking like they're listening. Bauer straightened. His face had changed. He looked around the room, and then he said, out loud, in a voice that carried, "Is there an Olivia Bennett in this department?" The room went still in the specific way that rooms go still when something unexpected has just been introduced into them. Richard Voss's head turned. Olivia didn't move for a moment. She was standing near the supply cart, gloved, and she thought, in the space of 2 seconds, "This is not something I planned for, and it changes everything about the next hour of my life." "Here," she said. Every pair of eyes in the room found her. Richard's jaw tightened. "She doesn't work here anymore." Bauer looked at the man on the gurney. The man's hand was still on his sleeve. Bauer looked at Richard. "Sir, he's specifically requesting—" "I heard what he's requesting," Richard said. "She's been discharged from this facility. She has no authorization to be in this department." He looked directly at Olivia. "You need to leave. Now." The man on the gurney turned his head. His eyes found her through the crowd. She could see the effort it cost him, the way his jaw set, the way he forced himself to focus across the distance. He knew her. She didn't know from where. Not yet. But the recognition was real, and it was specific, and it wasn't the kind of recognition you had with someone you'd met at a conference or treated once in a clinic. This was something older, something that had weight to it. "Olivia Bennett," he said, and his voice was wrecked, dry and damaged, too little air behind it. But it was clear enough to carry. "Get her in here." The trauma team was moving him toward the suite. Bauer was walking alongside, looking at the monitors, looking at the dressings, and Olivia could see from where she was standing that the torso wound was the problem. Penetrating trauma, left lower thorax. Field dressings had bought time. Not much. "She's not authorized," Richard said again, louder. "Someone escort her out." No one moved to do it. The security officer near the bay door looked at his feet. The junior nurses looked at each other. Bauer stepped out of the trauma suite doorway and looked at Richard with the expression of a man who had stopped being polite. "Richard, his pressure is dropping. I need every good hand in that room." "Then use the hands you have." "I'm telling you, I need more." "She is not on staff." Olivia watched this exchange. She watched the monitor above the gurney. She watched the readout tick and then dip. She knew that dip. She'd seen it before. Not in this building, not in any building like this one, but in places that had no walls at all, where the difference between a dip and a flat line was about 4 minutes and whether somebody with the right training was close enough to act. She had spent a long time not being that person in a visible way. She looked at the man on the gurney. He was still watching her. His eyes were the only fully alert thing about him. She pulled off her lanyard. She hadn't turned it in yet. It was still around her neck, and set it on the supply cart. "Olivia." Richard's voice had dropped to something quieter and more deliberate. "Walk away. You've been terminated. This is not your problem anymore." She looked at him. "I know," she said. She walked into the trauma suite. Behind her, she heard Richard call for security again. She heard Bauer say something to him. She couldn't catch the words over the noise of the equipment. And then she heard Richard say, loudly, "I want her removed from this building." What she did not hear, because she had already moved to the left side of the gurney and pulled on a second pair of gloves and begun assessing the wound, was whether anyone agreed with him. The man's name was on the intake wristband. They'd gotten that much from the soldiers who'd come in with him. She glanced at it. Commander D. Reyes. She filed it away. "Commander," she said, leaning into his field of vision. "I'm here. Can you tell me where the pain is most acute?" His eyes focused on her. He was fighting to stay in the room. She could see it, the way a person looks when they're trying not to go under. "Left side," he said. "Went in low." "I see it. We're going to take care of it. You're at Northbridge Medical Center. You understand?" "Yeah." A pause. His hand moved, reaching for something that wasn't there. How long was I out? I don't know yet. They're going to tell us. She looked up at the nurse across the gurney, a woman named Patrice, who'd worked trauma for 11 years and who was already running the second IV line without being asked. What's the field report? Patrice shook her head slightly. Minimal. Crash recovery. They pulled 3 from the aircraft. He's the worst. Bauer appeared at the head of the gurney. He looked at Olivia. He didn't say anything about what had just happened with Richard in the corridor. He said, Imaging is 4 minutes out. Surgical is being paged. Tell me what you're seeing. Left lower thorax penetrating, entry wound, no visible exit. Field dressings have been holding, but he's losing volume. He needs imaging, but I want to know if... She pressed carefully, watching his face. Yeah, he needs a chest tube. There's air in there. Bauer leaned over, checked, straightened. Agreed. Let's move. Olivia worked. She did not think about Richard Voss. She did not think about the HR appointment she hadn't completed. She did not think about what was going to happen after this, legally or professionally or in any other way. She thought about the man on the table and the instruments in her hands and the next necessary thing. That was the way she'd always done it. Outside the trauma suite, through the small window in the door, she could see the corridor. Richard was still out there. He was on his phone. His face was doing something she couldn't fully read from this angle, but his body language had changed. He was no longer the person running the room. He was the person on the outside of a room, making calls, which was a different kind of energy entirely. 2 of the soldiers who'd arrived with Reyes were standing in the corridor. They were watching the door. One of them caught her eye through the window. He gave her a single, small nod. She turned back to the patient. Outside, she could hear more vehicles arriving. More than one. The specific low rumble of heavy transport, not ambulances. Something with more weight behind it. She didn't look up. BP's still dropping, Patrice said. I know. Stay with me. Olivia reached for the next instrument. We're not losing him. Reyes's hand, against all probability, moved to the edge of the gurney. His fingers found the rail and held on. She glanced at his face. His eyes were still open. He was still fighting. I've got you, she said. Through the window in the trauma suite door, she could see the corridor filling with people she didn't recognize, not hospital staff. Different posture, different clothing. She kept working. Down the hallway, someone opened the main ER doors, and a man in a military uniform walked into Northbridge Medical Center with the bearing of someone who had not come to ask for anything. The man's name was Colonel Aaron Taft, and he walked into Northbridge Medical Center the way people walk into rooms they've already decided they own. He was 61, built like someone who had spent his youth in the kind of places that don't make it onto maps, and his uniform had the particular precision of a person who hadn't stopped caring about such things despite the years. 3 stars on his collar, combat infantry badge, a row of ribbons that would have taken someone 20 minutes to read and understand. He moved through the ER entrance without breaking stride, and the 2 MPs flanking him, one on each side half a step behind, had the practiced economy of motion that came from doing this specific thing many times before. The ER staff saw him and adjusted. Not dramatically. Just the small recalibrations people make when the energy in a room changes. A nurse who'd been walking fast suddenly walked with more intention. A resident near the central station stood a little straighter without quite knowing why. Richard Voss stepped forward from near the corridor wall with the expression of a man who had prepared something to say. Taft didn't look at him. He looked instead through the small rectangular window in the trauma suite door. He stood there for exactly 3 seconds. Then he turned to the MP on his left and said something low, and the MP moved to the door and opened it, and Taft stepped into the room. Olivia registered his presence peripherally. She didn't look up. "What's his status?" Taft asked. He was talking to the room in general, but he was looking at her specifically. "Chest tubes in," Bauer said from the other side of the gurney. "We've got the bleed partially controlled. Pressure's coming up, but he's not stable. We need surgical in here." "Where is surgical?" "Paged. They're 3 minutes out." Taft moved to the head of the gurney and looked down at Reyes. Something moved across his face. Not visible enough to name, gone before it could be read. He put his hand on Reyes's shoulder, briefly, and then he pulled it away. "You're gonna make it," he said. It wasn't a comfort, it was an order. Reyes's eyes opened slightly. "Working on it, sir." Taft straightened. He looked at Olivia directly now. She was still working, checking the tube placement, monitoring the output, not performing attention she didn't have. "Bennett," he said. She looked up. His expression was complicated in the way of someone who is carrying history with them into a present that doesn't know about it. "Good to see you." "Colonel?" She returned her eyes to the patient. "Not the circumstances I'd have picked." "No." He watched her hands for a moment. "Never is." Richard Voss appeared in the doorway. He'd apparently followed Taft in, or tried to, and the MP was now standing in a position that was technically polite and practically blocking. "Colonel!" Richard's voice had taken on the register of someone trying to sound like an equal. "I'm Richard Voss, Director of Northbridge Medical Center. I want to welcome you and your team. We're doing everything we can for your officer." Taft looked at him. "Good. I do need to flag that there's a staff situation I'm managing. The nurse currently in this room was formally separated from our staff this morning, and I need to ensure our protocols." "She stays," Taft said. Richard blinked. "Sir, I understand, but the liability—" "She stays." Taft said it the same way the second time. Not louder, not slower. The same way, which was somehow worse. "And you'll want to move back into the corridor. We're trying to save someone's life in here." Richard's face did something complicated. He looked at Olivia, and the look had layers to it. Anger, yes, and something underneath the anger that was closer to unease. He backed out of the doorway. The MP let the door close. Bauer glanced across the gurney at Olivia. She didn't acknowledge it. She was focused on the monitor, watching the blood pressure stabilize in small, grudging increments. Still not good. Better than 4 minutes ago. The surgical team arrived. Dr. Kwame Asante, a cardiothoracic surgeon who was technically off his usual shift, but who'd come in fast when the page went out, and 2 surgical nurses who moved with the tight efficiency of a team that had worked together long enough to function without speaking. Asante looked at the chart, looked at Olivia's hands, looked at the tube placement, and said, "Nice work on the decompression." Then he was in motion, and the room rearranged itself around him. Olivia stepped back to the periphery, which was correct. Her immediate role was done. She pulled off the soiled gloves and put on fresh ones and watched, because watching was useful even when acting wasn't. Taft moved to stand beside her. For a moment, neither of them said anything. The room was full of the particular sounds of controlled emergency, equipment, clipped instructions, the ventilator establishing its rhythm. "You had your hands in his chest 2 minutes after he arrived," Taft said. He wasn't accusing her. He was stating a fact in the way of someone who found it meaningful. Someone had to. "The director tried to pull you out." "Yes." Taft was quiet for another moment. Then, "How long have you been here, at this hospital?" 4 years. "And they didn't know." It wasn't a question. She answered it anyway. "I never told them. It wasn't relevant." He made a small sound that might have been agreement or might have been something else. "It's relevant now." She looked at him sideways. He was watching Asante work. His profile was a carved thing, jaw set, eyes steady. He'd aged since the last time she'd seen him, which had been 8 years ago in a debrief room in a building that didn't have a public address, and the aging had made him look more like himself, not less. "How did he end up here?" she asked. "Training exercise out of Calvert Air Station, 22 miles east. Bird had a mechanical failure on approach. Pilot put it down here." A pause. "Closest trauma facility." "He asked for me." "I know." "He knew I was here." Taft was quiet for 3 seconds. "We've known where you were, Olivia, since you left." He said it plainly, without apology, like it was simply a piece of information. "We keep track." She turned that over in her mind. She'd suspected something like it. There had been small things over the years, moments that almost felt like something larger was watching peripherally. But hearing it stated directly produced a different quality of feeling than suspicion had. "You didn't tell me," she said. "You needed the distance. We respected that." He finally looked at her. We weren't surveilling you. We were looking out. There's a difference. She wasn't sure there was exactly, but she let it sit. Ticked. Richard Voss, in the corridor outside the trauma suite, was on his phone. He was trying not to look like a man who was panicking, which meant he was holding the phone very casually and speaking in a voice just slightly quieter than normal and standing near the wall rather than in the center of the hallway. Anyone who'd been watching him for the last 20 minutes would have read all of this accurately as panic. The voice on the other end of his phone was not helping him feel better. "How many of them?" the voice said. "I don't know exactly. Military vehicles in the parking structure. I can see 3 from the window. The colonel's inside with 2 MPs. There may be more in the building. I haven't done a full... Why are they there?" "Helicopter crash. It was an accident. They came here because it's the nearest..." "That's all it is? An accident?" Richard lowered his voice another notch. "I don't know. I don't know why he asked for her." "Who is she?" "A nurse. Was a nurse. I terminated her this morning." He rubbed the back of his neck. The motion was fast, involuntary. "She worked here 4 years. I never had any indication she had..." "Find out who she is," the voice said, "and get those records moved before anyone starts looking at the procurement files. Today, Richard." The call ended. Richard stood in the corridor and breathed through his nose for a moment. Down the hall, 2 of the soldiers who'd arrived with the wounded officer were sitting in the waiting area. Not waiting, exactly. Watching. The distinction was small and significant. He turned and walked toward his office with the careful speed of a man trying not to look like he's retreating. The operation took 2 hours and 17 minutes. Asante was good, methodical and fast in a combination that was harder to achieve than either quality alone. Olivia stayed in the room for the first 40 minutes and then was asked by one of the surgical nurses, gently but clearly, to step back to the outer area because they had enough hands and she wasn't part of the surgical team. She understood. She went. She sat in the corridor outside the OR suite on a plastic chair and drank bad coffee from the vending machine 2 floors down. Patrice brought her a different cup from the break room, which was marginally better. They didn't talk about what had happened before the crash. They didn't talk about Richard. They sat for a few minutes in the specific silence of people who have just come through something and are waiting to find out if it worked. "You're still here," Patrice said eventually. "It wasn't an accusation, it was an observation." "Yeah. HR's been paging you." Olivia looked at her phone. 3 notifications from the hospital's internal system. "I know. What are you going to do?" Olivia considered the coffee cup. "I don't know yet." Taft found her there 20 minutes later. He pulled a chair over with no ceremony and sat down and stretched his legs out in front of him like a man who had not sat in several hours, which was probably accurate. "He's still in surgery," Olivia said. "I know. They're keeping me informed." He looked at the wall across from them. "I need to tell you something." "Okay." "We didn't just come here because of the crash." He said it evenly. "The crash brought us here, but there were already people looking at this facility." She turned to look at him. "Looking at it for what?" He was quiet for a moment. Choosing, she thought, not what to say, but how much to say right now. "Military procurement runs through a lot of channels," he said. "Medical supplies, pharmaceuticals, equipment. There's a network of contracts, civilian hospitals, suppliers, logistics. Most of it is clean. Some of it isn't." He glanced at her. "We've been following a thread for about 14 months. Supply irregularities, equipment invoiced to military contracts, then physically absent from inventory. Medical-grade materials that showed up in hospital systems, billed to federal accounts, but never made it to the field units they were assigned to." Olivia was quiet. "How close was the thread to this building?" she asked. He didn't answer that directly. He said, "When the helicopter went down here, 2 investigators who were already in West Haven City made some calls. Let's say it accelerated a timeline." She looked at her coffee, then at the wall, then at him. "Richard Voss," she said. It wasn't a question. Taft didn't confirm it and didn't deny it. He said, "The investigation is ongoing. I'm not in a position to..." "Olivia, I need you to understand that this is sensitive, and I'm telling you this much because you're involved now, whether you wanted to be or not. Not because I can brief you fully. The termination, she said slowly, this morning, was that? We don't know yet if it was connected. It may have been preemptive. Someone clearing the space, he paused. Or it may have been completely routine and badly timed. We're not sure. She sat with that. The idea that she'd been fired this morning not because of manufactured complaints about documentation, irregularities, and fit, but because someone had started to believe the right eyes were getting close, and she, without knowing it, by just being present and competent and difficult to dismiss, had somehow become a liability. It had a specific, ugly logic to it. He didn't know who I was, she said. Probably not. If he had, he'd have moved against you much earlier. Taft leaned forward, elbows on knees. Which means you were useful to him as long as you were invisible, and a problem when you weren't. The corridor was quiet. Somewhere down the hall, a door opened and closed. What happens now? She asked. Surgery finishes. Reyes recovers, assuming he does, and I believe he will. And the people who were already in West Haven get to work. He stood, because Taft was not a man who sat for long. You should probably go complete your exit process. You're telling me to walk away. I'm telling you to let the people whose job this is do their job. He looked at her. You've done yours. She looked back at him. He's still in surgery. Taft held her gaze for a moment. Then, almost imperceptibly, something shifted in his expression. Not quite a smile. Something older than that. He is, he said. Yes. He left. Bad. Olivia did not go to HR. She went to the second-floor break room, which was empty because everyone on the second floor was managing the ripple effects of a code silver, and no one had time to take a break. She sat at the table near the window and looked at the parking structure across the street and counted, as Taft had mentioned, the military vehicles. 3 in the structure. 2 more on the street below. She hadn't seen those. A dark SUV with government plates parked at an angle that suggested its occupant might need to leave quickly. She thought about what he'd said. 14 months. Supply irregularities. Equipment invoiced to military contracts. She was not an investigator. She didn't have access to procurement records. She'd been at this hospital for 4 years doing nursing work and only nursing work, and she had no reason to have looked at anything beyond patient charts and medication orders. But she'd been present. She'd paid attention because that was her fundamental condition. She paid attention to things, even things that weren't her direct responsibility, because attention was how she stayed ahead of consequences. She thought about the supply closet on Ward C that had been reorganized 6 months ago by someone from facilities management, and how the inventory count afterward had been. Not wrong exactly, but not right in a way she hadn't been able to specify. She'd mentioned it to the charge nurse. The charge nurse had said facilities management had an updated system and not to worry about it. She thought about the pharmaceutical cart that had come up short on a Tuesday 2 months ago and been quickly corrected without a formal incident report, which was slightly unusual. She thought about Dr. Marcus Webb, the director of clinical operations, who had been in Richard Voss's office this morning with that folder across his knees. Webb, who had been Richard's operational right hand for the entire time she'd worked here. Webb, who had sat in that chair with the specific passivity of a person who already knew the outcome of a meeting before it began. She pulled out her phone. She opened her notes application and began typing, quickly and methodically, because information degraded if you let it sit without structure. And these were things she had seen that she couldn't unsee, and she wasn't sure who would need them or when, but she wrote them down. She was on the 7th item when the break room door opened. It was Cass. The younger nurse stopped when she saw Olivia, and then she came in and let the door close behind her, and she didn't say anything for a moment. "You're still here," Cass said. "Third time someone said that to me today." Cass sat down across from her. She looked like she'd been through something, flushed, slightly disheveled, the particular look of a person who had been running on adrenaline for 2 hours and was only now starting to feel it metabolize. "It's intense out there," Cass said. "The military people... There are more of them now. I counted 6 in the ER alone. And there's a woman in a suit on the 3rd floor who isn't hospital staff. I don't know who she is, but she went into the records room with 2 of the military guys, and they haven't come out." Olivia looked up from her phone. "The records room," she said. "Yeah, medical records. And I think I overheard. I wasn't trying to. I was just at the nursing station. I think it wasn't just medical records. I think it was procurement, administrative files. Olivia put her phone face down on the table. Where's Voss? She asked. His office. He hasn't come out in 40 minutes. Sandra, his assistant. She looks like she's about to cry. I asked if she was okay and she said she was fine, and then she looked over her shoulder at his office door. Cass paused. What's happening, Olivia? Like, actually happening? I don't know the full picture. But you know something. She looked at Cass across the table. 23, 3 months in. Good instincts, which would either serve her well or get her into trouble depending on the next several hours, and who noticed her noticing things. Do your job, Olivia said. Keep your head down for the rest of this shift. Don't go near the 3rd floor. You said that this morning. Keep my head down. I meant it this morning. I really mean it now. Cass was quiet. Then, the man they brought in, the military officer, he's out of surgery. Olivia went still. What? Patrice just paged me. She's up there. He's in the recovery suite. Cass seemed to feel the weight of the word. Stable. They're saying stable. Olivia picked up her phone, put it in her pocket, and stood up. He was pale and tubed and hooked to 3 different monitors, and he looked, objectively, terrible. Olivia had seen plenty of post-surgical patients, and she knew that the standard of comparison was not how they looked, but whether they were alive and trending in the right direction. And by that measure, Reyes was, at this moment, acceptable. His blood pressure was better than she'd expected. His oxygen sat was holding. Asante had written a brief note in the new temporary chart that Patrice had shown her. 4 lines, the last of which was prognosis guarded but favorable. Guarded but favorable was practically a love letter in surgical notes. She stood at the window of his room, ICU adjacent, private, 2 MPs outside the door, and looked at him through the glass. He was unconscious. He'd be unconscious for hours. Taft was there in a chair beside the bed, which was unusual. Senior officers didn't typically sit vigil. They sent staff. She noted it without commenting on it because it told her something about Reyes specifically, and she already had enough data to work with. She tapped on the glass. Taft looked up and came to the door. He'll be out for a while, she said. I know. He studied her face. You didn't leave. Not yet. He seemed to be making a decision about something. Come with me. She followed him down the corridor to a small conference room, the kind used for family meetings, 2 couches and a box of tissues on the table, and a window that looked at a brick wall. Another person was already in there. A woman in her late 40s, civilian clothes, dark blazer. The kind of haircut that said she'd stopped thinking about her hair as a form of self-expression a long time ago. She had a laptop open and a yellow legal pad covered in tight handwriting. This is Agent Vera Solano, Taft said. She's been running the procurement investigation. Solano looked at Olivia. Ms. Bennett, or do you prefer... Olivia is fine. Olivia, she gestured to the couch. Sit down if you want. This won't take long. I know it's been a long day for you. Olivia sat. What do you need? You worked here 4 years. Ward C primarily, with rotations through other departments? Yes. Did you ever have direct involvement with medical supply procurement? Signing off on orders, receiving shipments, verifying inventory? No, that's administrative side. Nursing staff on the ward don't handle procurement directly, but we interact with supply inventory. We use it, we notice when levels are off. Solano's pen moved. Did you notice when levels were off? Occasionally. I noted 2 incidents in the past 6 months that seemed slightly irregular but didn't rise to formal reporting. She took out her phone and pulled up the notes she'd written in the break room. I wrote them down an hour ago. I can send you this. Solano looked at the phone and then at her with a sharpened attention. You wrote them down today? I wrote them down after Colonel Taft told me what the investigation was about. I didn't know they were relevant before that. Solano held out her hand. May I? Olivia handed her the phone. Solano read. Her expression didn't change. Good control, the kind that came with practice. But her writing hand moved, even though she wasn't holding the pen. She handed the phone back. The supply closet reorganization you mentioned, Solano said. Do you remember who in facilities management handled it? I don't know his name. Mid-40s, heavy set. He had a Northbridge facilities badge. He was here 2 days. And after the reorganization, the count was off. Not dramatically. That's what made it easy to dismiss. If the discrepancy is small enough, and if someone with authority says it's a system update, most people move on. But you didn't move on. I moved on from pursuing it formally. I remembered it. Solano made a note. The pharmaceutical cart shortfall in March. February, actually. February. Was that documented anywhere? I don't think so. The charge nurse on that shift made a verbal note, and the cart was corrected before morning rounds. There's no written record as far as I know. The charge nurse's name? Olivia hesitated one beat. Telling you that involves a colleague. We're not investigating nursing staff, Solano said. We're trying to establish a timeline and a pattern. The name helps us understand whether the correction came from inside normal channels or from someone with awareness of the issue. It was a reasonable answer. Olivia gave her the name. Solano closed her laptop. One more question. In your 4 years here, did you notice a pattern of staff who raised concerns being subsequently managed out? Complaints, performance reviews, terminations. Olivia looked at her. I notice I was terminated this morning, she said, after 4 years with no formal adverse actions. Yes. Solano met her eyes. We noticed that too. The room was quiet for a moment. Outside in the corridor, someone walked past quickly. Then a second person, moving in the same direction. Taft, who had been standing near the window, straightened. Solano picked up her radio from the table. She pressed the call button without looking at it, muscle memory, and said, "What's the movement?" A voice came back. "Third floor, director's office. He's on the move. Looks like he's got a bag." Solano was already standing. She looked at Taft. Something passed between them in the shorthand of people who have worked together long enough to skip the words. She looked at Olivia. "Stay in this room." Then she was out the door. Taft followed. The door swung closed. Olivia sat for 3 seconds. Then she stood up and went to the door and opened it and looked into the corridor. The building had changed. She could feel it in the way you feel a change in atmospheric pressure, not with any single sense, but with all of them simultaneously. People were moving with purpose that wasn't medical. Elevators were cycling. There was a radio communication happening somewhere nearby that she could hear fragments of, all of it too clipped to parse fully. She moved toward the stairwell because the elevators would be slower and she wanted to see, not because she had any intention of getting in the way. The third floor housed administration, director's suite, clinical operations, HR, and the financial records department. She'd been up there maybe 6 times in 4 years, and each time it had looked the way administrative floors looked. Quiet, carpeted, slightly formal. She pushed open the stairwell door on the 3rd floor. It was not quiet. Richard Voss was in the corridor. He had a leather document bag over his shoulder, and he was moving toward the elevator with the speed of a man who had made a decision. He had not seen her. He was looking straight ahead, jaw set, the particular expression of someone who is mentally committed to a course of action and is in the execution phase. 2 MPs appeared from around the corner at the far end of the corridor, moving toward him at a pace that was not quite running but was faster than a walk. Behind them, Solano. Richard saw them. He stopped. For a moment, nobody moved. Then Richard turned, and he was facing her. He hadn't planned to. She was just there, in the stairwell doorway, and his eyes found her by accident in the second he turned to look for another direction. The leather bag was on his shoulder. His face went through several things very quickly. Surprise, then calculation, then something that was almost the look of a man who has run out of moves and knows it. "Get out of the way," he said. His voice was still trying to be the director's voice, but the register was wrong. Too high, too fast. "I'm not in your way," Olivia said. "I'm in a hallway." "Olivia?" He took 1 step toward her, not threatening, just directional. And then he stopped because Solano had closed half the distance, and one of the MPs had moved into a position that wasn't aggressive, but wasn't anything else either. "Mr. Voss," Solano said, "I need you to set the bag down." I have a legal right to take personal property. The bag, Mr. Voss. Now. He looked at Olivia again. She didn't know what he was looking for. She didn't give him anything to find. He set the bag down. Solano reached him. She spoke to him in a voice too low to carry, and whatever she said made Richard go very still. One of the MPs picked up the bag. Olivia looked at Richard Voss, this man who had sat behind his enormous desk this morning, and said, "You're finished here," with the confidence of someone who had never considered that certainty had an expiration date. And she felt something that wasn't quite satisfaction and wasn't quite relief. It was closer to clarity. The specific quality of feeling that comes when a thing you understood to be true is confirmed by reality. He didn't look at her again. Solano walked him toward the elevator, one MP on each side, not touching him, not needing to. The leather bag went with the third MP. The elevator doors opened. All of them went in. The corridor was empty. Olivia stood in the stairwell doorway and breathed. Down the hall, the door to the financial records room was open. Through it, she could see a woman at the filing cabinets. Someone in a different suit than Solano, older, reading glasses, moving with the deliberate efficiency of a person who has been here before and knows what she's looking for. On the desk nearest the door, open and clearly not yet moved, was a folder. She could see only the header from this distance. She couldn't read it fully. But she could see two things: the Northbridge Medical Center letterhead, and below it, a figure, a dollar amount, that was followed by enough zeros that she had to look twice. The woman in the records room looked up and saw Olivia in the doorway. She didn't say anything. She closed the folder. But before she did, she turned it slightly. Not much, just enough, so that the header was visible for one more second. Olivia read it. She stood very still. The name at the top of that contract wasn't Richard Voss's, it was Marcus Webb's. And below Webb's name, listed as a co-signatory on a procurement agreement worth more than she'd processed in that single glance. A name she didn't recognize. An outside supplier. A company she'd never heard of. The woman in the records room closed the folder and put it in her bag and picked up her radio. Olivia stepped back from the doorway. She stood in the stairwell with her back against the cool painted cinder block and her mind running through the architecture of what she'd just understood. That Richard Voss had been in that office this morning, yes. And he had fired her, yes. And he was the face of everything that was wrong with this building. But he might not be the foundation of it. Foundations were harder to see. That was the point of them. She thought about Marcus Webb in his folder, his particular passivity in Voss's office, the way he'd said, "Olivia, the purpose of this meeting isn't to relitigate individual incidents. Not cruel, just efficient." The phrasing of a man managing a process, not reacting to one. She took out her phone. She had Taft's number from years ago. She didn't know if it still worked. She typed, "Webb. Look at Webb. Co-signatory on procurement. I just saw a contract in the records room. Outside supplier I don't recognize." She sent it. 3 seconds later, the read receipt appeared. Then, 30 seconds after that, her phone buzzed with a single line of text. "Don't go back to your floor. Stay where you are. Someone's coming to you." She stared at the message. Somewhere below her in the stairwell, a door opened, footsteps on the stairs. Coming up. She looked over the railing. It wasn't military. It wasn't Solano. It was Marcus Webb. He was moving fast, taking the stairs two at a time, the kind of urgency that meant he wasn't going toward something. He was going away from it. His jacket was off. He had a phone in one hand and what looked like a USB drive in the other, and he wasn't looking up. He hadn't seen her yet. She had perhaps 4 seconds before he did. She had 4 seconds and she used them to think instead of move, which was the right call. Webb was coming up. He hadn't seen her. He was on his phone with one hand and holding the drive with the other, which meant both his hands were occupied and his attention was split. The stairwell was narrow. 2 people passing would require acknowledgement. He would see her face. He would recognize her. And whatever calculation was running behind his eyes right now, whatever he was moving toward or away from, seeing her here, in this stairwell, on this floor, right now, would tell him something he shouldn't know yet. She turned and pushed through the stairwell door back into the third-floor corridor. It was quieter than it had been 30 seconds ago. The MPs were gone with Richard. The woman in the records room had closed the door. The hallway had the specific hollowness of a space that had recently been full of activity and wasn't anymore. She moved left, away from the elevator bank, toward the fire exit at the far end of the corridor. There was a small alcove there. She'd noticed it once during a facilities meeting years ago, a loading access door that nobody used because the freight elevator was closer. She stepped into it and pressed her back against the wall. Through the stairwell door, she heard it open. Footsteps on carpet now, muffled, moving fast. She counted the steps. 4, 5, heading toward the elevator. A pause. The elevator was already on this floor. She heard the doors open, close, gone. She let out a breath. Then she typed into her phone. Webb just came up the stairwell with a USB drive. He took the elevator. I don't know which direction. The response came back in under 10 seconds, and it wasn't from Taft. It was from a number she didn't have stored. Building exits are covered. Stay on 3. Don't let him see you. She stared at the message. A number she didn't have stored, which meant Taft had forwarded her contact to someone who was already on the ground and positioned, and that meant this operation was larger than what she could see from the inside of this corridor, which should have been reassuring and was instead simply more information to carry. She stayed where she was. 40 seconds later, she heard the elevator again, doors opening on this floor. Footsteps, multiple sets, moving with purpose. She looked around the alcove edge. 2 men she didn't recognize, suits, not uniforms, the kind of shoes that had been chosen for durability over appearance, walked past her position without looking at the alcove and went directly into the financial records room. One of them had a radio. The other had nothing visible in his hands, which probably meant the nothing was deliberate. She put her phone away. But the next hour was not dramatic from where she was standing. That was the thing nobody told you about the moments around significant events. Most of it was waiting, proximity without participation, understanding only partially what was happening in the adjacent rooms. She went back to the second floor. She sat in the break room. Cass found her there at some point and sat across from her without asking questions, which Olivia appreciated more than she would have been able to articulate. Patrice came in at the 45-minute mark and said that Reyes was awake. Not alert, post-surgical awake, which meant responsive to name and pressure, oriented to place if not fully to time, in significant pain but manageable. Asante had been in. Taft had been in. The 2 MPs outside the door were still there. He asked about you, Patrice said. Olivia looked up. Asked if you were still in the building. Patrice sat down. Taft told him yes. That's all? That's all I heard. She paused. There are federal agents on 3, like multiple, not just the military ones, different agency. Someone told me they're going through Webb's office. Webb's office, Olivia said. He's not in it. Nobody knows where he is. Olivia said nothing. Patrice read the silence correctly. You know something. I know pieces of things. She looked at the window. Nothing I can fill in for you right now. Patrice accepted that. She was a practical person, which was one of the reasons Olivia had always respected her. The staff are... people are scared. They don't know what the investigation is about. There are rumors. Someone said it was about the crash, just the crash. Someone else said it's been going on for months. She paused. Elaine Hargrove went home. Called in a personal emergency. That landed differently than the other information. Elaine Hargrove, chief of nursing, who had stood in Richard's office this morning by the bookshelf and looked at the wall when Olivia had asked her to name a specific thing Olivia had done wrong. The woman who had used the word fit as a weapon. Who had not objected. When did she leave? Olivia asked. 20 minutes ago. 20 minutes ago, Webb had been in the elevator with a USB drive. Elaine Hargrove had left the building. Richard was wherever they'd taken him. The pattern was not subtle if you were looking at it from the right angle. She pulled out her phone and typed, Elaine Hargrove, chief of nursing, left the building approximately 20 minutes ago. She sent it to the number she didn't have stored. This time the response took 2 minutes. Already flagged. She's being contacted. The call came from Taft at the 2-hour mark. He wants to see you, Taft said. If you're willing. She didn't ask who. I'll come up. The ICU adjacent suite was warmer than the rest of the hospital. Someone had adjusted the temperature for the patient, or perhaps just for the colonel, who was still in his chair and who looked, for the first time, like a man who had spent a long day. The MPs were still outside. The monitors were quieter than they'd been. Reyes was awake. Actually awake. Eyes tracking, head turned toward the door when she came in. His color was still poor, and he was propped at an angle that was clearly the result of negotiation between his comfort and what the surgical team would allow, which meant he'd been arguing about it, which told her something about him. She pulled the chair closer and sat down. He looked at her for a moment without speaking. His face was the face of a man who had been through something and hadn't finished processing it, but who was going to try to conduct himself correctly in the meantime. "You pulled the chest tube yourself," he said. His voice was rough. Intubation left its mark. "I assisted. Bauer led." "That's not what Bauer says." She didn't argue with it. "How's the pain?" "Manageable." Which almost certainly meant it wasn't, but she let it go. "I owe you an explanation." "You don't owe me anything." "I know how you are about that." His eyes moved briefly to Taft in the corner, then back to her. "But I'm going to give it anyway." She waited. 12 years ago, he said. "Kabbalah province. You know what I'm talking about." She did. "I was the lieutenant on that extraction," he said. "You were the medic. We lost 3 and you kept 4 alive in conditions that you know what the conditions were. I've thought about it more times than I can count." He paused, and the pause was not theatrical. It was a man choosing precision. "When I heard you were out here, just working, in a civilian hospital, I kept track, same as the others." "The others," she said, "the ones you kept alive. We check in on each other. It's informal, but we check." His jaw worked slightly. "When I got the brief about the investigation, Northbridge, the procurement angle, I made sure we were the unit assigned to the training exercise. I wanted eyes close to this facility." She looked at him. "You knew about the investigation." "I knew enough. Not the full scope. Solano runs that. But I knew enough to be concerned." He shifted, and the shift cost him. She could see it in the brief tightening around his eyes. "I didn't know you were going to get terminated this morning. That wasn't... I would have moved faster if I'd known." "You couldn't have predicted it." "No, but I should have been closer." He said it plainly, without performance. Just accounting. "The bird going down wasn't planned. That was just the day deciding to be what it was. But I'm glad it was here." She sat with that for a moment. The room was quiet except for the monitors. "The USB drive," she said. Taft, from his chair in the corner, recovered. "Webb didn't make it out of the building." She looked at him. "What was on it?" Taft and Reyes exchanged a brief look, the kind that meant the answer existed and they were deciding how much of it she got. "Enough," Taft said. "Enough to close the case?" "Enough to open it wider than we expected." He stood. "Solano is briefing her supervisors now. There are names on that drive that go outside this building." She understood what that meant. The outside supplier. The contract with Webb's name. The network didn't end at Northbridge's administrative floor. It had always been larger than that, and the building was a node in it, not the source. She looked at Reyes. "What happens to the staff who didn't know?" "They cooperate with the investigation, and they go back to work," Taft said. "The people who knew and didn't act? That's a harder question. There's a range." "Elaine Hargrove. She's talking to investigators right now." He said it without inflection. "She's making choices about what she wants the next few years to look like. People in that position often get very helpful very quickly." Olivia nodded slowly. Reyes watched her. He looked like he wanted to say something more, and then the door opened and Asante came in for a check, and the room shifted into medical protocol. Olivia stood, moved to the periphery, watched Asante run through the post-surgical assessment with the focused efficiency she'd observed earlier. Reyes answered every question with the shortest possible answer. His pressure was holding. His lung sounds were better than they'd been an hour ago. Asante looked at Olivia on his way out. "You should have been on my surgical team years ago. You managed fine without me." He made a sound that was not quite disagreement and left. She turned back to Reyes. He was watching her with the particular attention of someone who had been managing pain long enough that it had become background and could now see through it clearly. "They're going to offer you something," he said. She went still. What? Officially, from the military side, Taft has been in conversations. He glanced at Taft. Tell her. Taft crossed his arms. There's a commendation that was recommended and never processed. From Kabbalah. You left before the paperwork cleared, and then it got complicated. We've been working on uncompleting that. He met her eyes. And separately, there's a conversation about whether your role in today's events warrants additional recognition. I did my job. You did considerably more than your job, Taft said, and the people who've been watching this investigation for 14 months would like to say so formally. She was quiet. The word recognition had always sat wrong with her, not because she doubted the value of it, but because the version of herself that needed it was one she'd spent a long time learning to not be. She'd done what she did because it was what the situation required, and because she was built to do it. That was all. But she also understood that there were people in hallways and wards in this building who had dismissed her, and not because of information, because of appearance, because of role, because she'd been easy to overlook, and they hadn't worked to see past that. And there was something in the idea of being seen correctly, formally, on record, that was different from needing recognition. It was about the record, the actual truth of a thing being documented in a place where it couldn't be quietly removed. We can discuss that later, she said. We will, Taft said. Reyes's eyes had started to lose focus. Not dangerously, just the weight of recovery asserting itself against his willingness to stay awake. She recognized the pattern. Sleep, she said. I'm fine. You're not. Sleep. He almost smiled. It moved across his face and then his eyes closed, and the monitors held their rhythm, and for a moment the room was simply quiet. She stood there for another minute, watching the monitor, because that was habit, and habit was useful. Then her phone buzzed. She looked at the screen. It was the number she didn't have stored, the one that had been directing her since the corridor. The message was 4 words. We need you upstairs. She looked at Taft. He was already reading his own phone, and his face had done the thing it did when information arrived that changed the shape of a situation. What is it? She asked. He looked up. Webb had a partner, he said, inside the hospital. Not Hargrove, someone else. And Solano thinks they just activated a contingency. What kind of contingency? He was already moving toward the door. The kind, he said, that involves the patient records of every person in this building who ever filed a complaint about hospital administration. The patient record system at Northbridge ran on a server cluster in a locked room on the 4th floor that most clinical staff had never seen and didn't think about. It was the kind of infrastructure that existed in the background of everything, powering the charts, the imaging requests, the medication orders, the complaint logs, and because it worked, nobody paid attention to it. Which was, Olivia understood as she followed Taft up the stairwell, precisely why someone had chosen it. The 4th floor was not a patient floor. It was mechanical and administrative, HVAC systems, the server room, medical records archival storage, and a cluster of offices used by the IT and compliance departments. She'd been up here once, years ago, for a records access training that had lasted 40 minutes and taught her nothing she hadn't already known. Solano was in the corridor when they came through the stairwell door, standing outside what Olivia recognized as the server room entrance. A reinforced door with a keycard panel, currently propped open with a chair. Inside, the noise of cooling systems was a constant low roar. What happened? Taft said. Someone initiated a remote wipe protocol on the complaint management database, Solano said. She was not visibly agitated. She was the kind of person who processed urgency inward, but her jaw was tight. It flagged it 40 seconds after it started. We stopped it before full deletion, but they got through 2 years' worth of records before the shutdown. 2 years, Olivia said. 2,411 individual complaint entries. Gone. Solano looked at her. What's intact is everything before that window. 48 months of prior data is clean. Olivia did the math. So everything from roughly when Richard Voss became director is significantly degraded. Solano nodded once. We're in recovery mode. The IT team thinks they can pull fragments from the backup architecture, but it's going to take time and there will be gaps. Who initiated it? That's what we're working on. The access credentials used belong to a compliance officer named Dale First. He's been on staff here for 3 years. She paused. He's not in the building. Taft looked at her sharply. Since when? He badged out at 11:14 this morning, 22 minutes after the helicopter hit the roof, while the code silver was active and every security monitor in the building was pointed at the ER. The timing was not an accident. 11:14. The crash had been at 9:50 something. The code silver had pulled everyone's attention downward and outward, toward the rooftop, toward the ER, toward the casualties. And in that window, someone had created space. He knew about the crash in advance, Olivia said. Not the crash specifically, but he knew the day was going to be complicated. Solano held up a printed sheet. His personal vehicle left the parking structure at 11:16. We have him on external camera at the intersection of 4th and Marley heading east. After that, nothing. He's not the top, Taft said. No, he's operational. Someone told him to activate the wipe and leave. The question is the same as before. Who above Webb was running this? Solano folded the paper. The drive you recovered from Webb, we've pulled a partial contact list. 17 names. 5 of them are inside this building or have regular access to it. First is one. The other 4 are still on site, or were as of 20 minutes ago. Were, Olivia said. 2 of them are in interviews. 1 is in surgery and not going anywhere. The 4th, Solano stopped. Her radio crackled. She pressed the receiver. Say again. The voice on the other end said something Olivia couldn't fully parse. Solano's expression didn't change, but her hand on the radio tightened slightly. Copy, she said. Hold him there. She looked at Taft. They found Webb. He was in the loading dock on the building's north side, a part of the hospital that was functional and perpetually unglamorous, all concrete and rolling freight doors and the smell of exhaust and cold storage. He'd made it out of the elevator and down a service corridor and through 2 doors that should have required keycard access, both of which were unlocked because the facilities department had been processing a supply delivery that morning and had propped them. Small failures producing large opportunities. He'd almost made it. A security officer stationed at the building perimeter had seen him crossing the loading area toward the far fence line. Webb was not built for moving fast. He was a desk-built man, indoor, and the sprint across the concrete dock had winded him. By the time the officer called it in and 2 of Solano's people converged from the street side, he was at the fence with nowhere left to go. Olivia wasn't there for the containment. She stayed on the 4th floor while Solano went down, because the IT team had questions about the complaint database structure that required someone who actually worked in the clinical system to answer them. And she was the most immediately available person who both had that knowledge and was cleared to be on this floor. She sat with a 26-year-old IT analyst named Perry, who looked like he hadn't slept in the last rotation and who was working through the backup architecture with the focused misery of someone trying to reconstruct a document after a hard drive failure. The entries aren't fully deleted, Perry said. They're overwritten, but the backup partition runs on a 12-hour cycle. Anything created before 9 p.m. yesterday should be recoverable. He clicked through screens quickly. The problem is the period between the last backup and when the wipe started. That's a 4-hour window. Whatever was filed this morning, new complaints, updates to existing records, gone, Olivia said. Probably. Maybe 70% gone. The fragments are there, but he gestured at the screen. It's like trying to read a page that's been soaked in water. The words are there, technically, most of them. She leaned forward. Can you pull anything from the complaint log for the last 3 months? Even fragmented? I can try. What are you looking for? She thought about what Taft had said. The network went outside the building. Webb's contact list had 17 names, 5 inside, 12 outside. The complaint database wasn't just about tracking patient grievances. It was where staff members filed reports too. Concerns about procurement irregularities, supply shortfalls, anything that put a written record of a problem into a system that someone in administration would see. Someone in administration with access to those records could have used them in reverse, not to address problems, but to identify who was watching and what they'd noticed. Staff complaints, she said, internal reports, anyone who filed a concern about supply management, procurement, inventory, in the last 18 months. Perry typed. The system groaned, which was not reassuring. Then a list began populating. Partial entries, some with missing fields, some with redacted-looking gaps where text had been degraded. She read down the list. 6 entries. 3 were clearly about supply issues. 2 nursing staff, one from a pharmacy technician named Garrett, who she vaguely recognized from the second floor. She scanned the names. Then she stopped. The 4th entry had a staff ID number but no name field. That portion had been wiped cleanly, but the date was 3 weeks ago, and the category was procurement irregularity, invoicing, and the note field, partially recovered, read, discrepancy between PO, number corrupted, and physical inventory on corrupted, estimate corrupted in medical-grade supplies, have documented photographic evidence, and then nothing. The rest was gone. Someone filed this 3 weeks ago, she said, with photographic evidence. Who has access to delete specific entries? Administrative level access, director tier, clinical operations tier. Perry paused. And compliance. Compliance. Dale First, who had badged out at 11:14 and driven east on 4th and Marley. The photographic evidence, she said. Where would that be stored? If they attached files to the complaint entry. System automatically routes attachments to a secondary server, different from the main database. Perry pulled up another window. The wipe only targeted the complaint database, not the attachment server. He looked at her. If whoever did this didn't know about the secondary server, they didn't know, she said. They were working fast. The wipe was automated, triggered, and walked away from. They didn't have time to find everything. Perry clicked. A directory appeared. 3 attachments associated with the corrupted entry. He opened the first one. Photographs. 12 of them, time-stamped, taken with a phone camera. Supply closet. Shelving units with labeled bins. She recognized the labeling system from Ward C empty bins, labeled with quantities that didn't match the empty space. A purchase order printout, photographed at an angle. A shipping receipt taped to the shelf, also photographed. The last 3 images were of an invoice, military contract header visible, a line item list of medical supplies, and at the bottom, a signature and a stamp. She could read the signature. It wasn't Richard Voss's. It wasn't Marcus Webb's. The name was Dr. Elaine Hargrove. Solano took the photographs without expression and studied each one for longer than seemed necessary, which was the behavior of someone who was being thorough rather than surprised, and which told Olivia that the name wasn't entirely new to her. She's talking to investigators right now, Solano said, on the 3rd floor. Does she know about these? She didn't know the attachment server existed separately from the database. None of them did. Solano closed the folder. This changes the interview. Who filed the original complaint? Olivia asked. The name field is gone. We can probably reconstruct it from the entry metadata. Perry's working on it. Solano looked at her steadily. It may have been someone who was subsequently pushed out. We're seeing a pattern. 3 of the 6 staff who filed supply-related complaints in the last 18 months were terminated or resigned under pressure within 60 days of filing. 3 people. Olivia thought of the complaint that had been manufactured against her this morning, the documentation irregularity that couldn't be specified, the pattern that Richard had cited, the performance review that had never existed before today. She'd been at this hospital 4 years without incident and had been removed in a single morning meeting. If she'd filed a formal supply complaint, would the meeting have come sooner? The termination this morning, she said. Mine. Solano met her eyes. We believe it was connected, not directly to you as an individual. You weren't under investigation. But someone in the administration flagged that the situation at this facility was becoming exposed, and there was a general directive to reduce what they called observational risk. Staff who were attentive and difficult to manage. She paused. You qualified on both counts. Observational risk, Olivia said. That's what they called it. That's the phrase that appears in Webb's correspondence. Yes. She turned that over. Observational risk. She had been fired from her job because she paid attention to things, because she was the kind of person who noticed a supply count that was slightly off and wrote it in a notebook and remembered it, and someone, somewhere in the architecture of this network, had identified that quality as a threat. It was almost funny. Not quite. They brought Webb up from the loading dock at 1:30 in the afternoon. She didn't plan to see it. She was in the fourth floor corridor getting ready to go back down to the clinical floors because the IT work was done and she had nothing more to contribute up here. And the elevator opened and there he was. He was not handcuffed. Not yet, or not visibly. He was flanked by two of Solano's people and he was walking under his own authority, but his body had the collapsed quality of a man who had stopped performing. The jacket was still off from the stairwell. He looked smaller without it, which was a cliché, but also true. He saw her. The hallway was narrow enough that they were going to pass within 8 feet of each other regardless. She stepped aside slightly to let the group through. Standard corridor courtesy, nothing more. He stopped walking. His escorts didn't restrain him up. They watched, but they let him stop, because stopping in a hallway wasn't threatening, just human. He looked at her. "I had nothing against you personally," he said. He said it like it mattered, like she should find it meaningful. She looked back at him. His face was doing the thing that people's faces did when they were trying to locate an emotion that would make them feel better about what they'd done. And she had the specific tired experience of recognizing the effort. "Okay," she said. That was all. His escorts moved him forward. The elevator came and they all got in. The doors closed. She stood in the corridor for a moment. Then she went down the stairs. The clinical floors had a different quality by mid-afternoon. The code silver had been formally downgraded. The immediate emergency was resolved. The building was structurally sound above the rooftop impact, and the remaining casualties from the helicopter were stable. Ward C had resumed something approaching normal operations. Patients in beds, nurses at stations, the overhead intercom doing its low-level background narration of the hospital's functions. But the normal was a surface thing. Underneath it, the building felt different, the way a room feels different after furniture has been moved, even when you can't immediately identify what changed. People were talking in different configurations, small groups by the nursing stations, conversations that stopped when certain people walked past. The name Voss came up in clipped fragments. So did Webb's. So apparently did hers. Cass found her in the supply room on Ward C, where Olivia had gone for no particular reason except that it was quiet and familiar, and she needed somewhere to stand for a minute that wasn't a corridor or a conference room. "There's something happening in the lobby," Cass said. She was trying to sound neutral and not managing it. "Like, a lot of people." "What kind of people?" "Reporters. Outside the main entrance. Security isn't letting them in, but there are cameras." She paused. "Someone leaked something. I don't know what." Olivia thought of the photographs on the attachment server, the invoice with Hargrove's signature, the list of 17 names on Webb's drive, 5 of them inside this building. 14 months of investigation running on a slow burn, and now the building had helicopter wreckage on its roof, and military vehicles in its parking structure, and federal investigators in its administrative offices, and none of that was invisible to West Haven City. "It was going to come out," she said. "What was?" "All of it." She set down the supply count she'd been idly checking. "How are the patients on C?" Cass blinked at the subject shift. "Fine. Normal. Mrs. Garland's discharge got processed. She left at noon. Harold Hayford's wife finally came up. They're arguing about whether he can have solid food. He can have solid food. I told her. She doesn't believe nurses." "Tell her Dr. Bauer cleared it." She paused. "He did clear it, right?" "Yeah, Yes, he did." Cass looked at her strangely. "You're still doing the job." "What else would I do?" "You were terminated this morning." "Yes." She picked up the clipboard again. "I know." Cass was quiet for a moment. "Are they going to fix that?" She thought about what Taft had said. "There's a conversation." She thought about Solano's careful phrasing. "We believe it was connected." She thought about a folder with 3 manufactured complaints and a director who had told her she was finished with the flat confidence of a man who had done this before and would do it again. "I don't know," she said honestly, "but they know it was wrong." "Yes," she said, "they know." Masa. The interview room on the third floor was a different one from where Solano had taken her earlier. A smaller space, 2 chairs, a table, a window with the blinds adjusted to let light in without providing a view. Olivia had been asked to come here by a name she didn't recognize, communicated through Taft, and she'd come because when Taft asked her to do things, she'd learned over the years that there was usually a reason she'd understand later, if not immediately. The woman already in the room was not a military investigator and was not from Solano's team. She was in her early 50s, civilian, with the particular bearing of someone who worked in policy rather than field operations. She introduced herself as Deputy Director Marcia Kwan from the Federal Healthcare Fraud Division, which was a name Olivia had heard of abstractly and never expected to be in a room with. "You've had an unusual day," Kwan said. "That's one word for it." Kwan smiled briefly and it reached her eyes, which was not something Olivia had been expecting. "I'll be direct with you. We've been building this case for 14 months. The investigation at Northbridge is one piece of a larger network, 11 facilities across 4 states, 3 military procurement channels, and a supplier network that's been billing federal accounts for medical supplies that were then sold through secondary channels at significant markup." She paused. "The total estimated fraud is in the range of $40 million. Olivia sat with that number for a moment. It was large enough to be abstract, and then it wasn't. $40 million in medical supplies that were supposed to go to military units and hospitals, and went instead into someone's secondary income stream. People who needed equipment who didn't get it. Shortfalls that got explained away. Supply counts that were slightly off and easy to dismiss." "Who's at the top of it?" she asked. "We're still establishing that. Webb's contact list goes further up than Webb. The USB drive it's useful, but it's a piece of the picture." Kwan folded her hands on the table. "What I want to talk to you about is the complaint records, the staff who filed concerns and were subsequently pushed out. 3 of them, according to Agent Solano. 6, if you extend the window further back. And we believe there are facilities in other states with the same pattern." She looked at Olivia directly. "You were terminated this morning under circumstances we now believe were network-directed. You're the most recent case, and because you're still here, and because of the events today, you are visible in a way that makes this conversation both possible and important. You want me to make a statement. I want several things, and I'll be transparent about all of them." Kwan shifted. "Formally, yes, a witness statement about what you observed at this facility regarding supply irregularities and the circumstances of your termination. That's procedural, and we'll handle it properly." She paused. "Less formally, I want you to understand the scope of what happened here, and to know that the documentation of what was done to the people in this building, the staff who were silenced, pushed out, intimidated, that documentation is a significant part of this case, not a footnote, a central element." Olivia looked at her. "Because the fraud is what it is, but what they did to people to protect it is also criminal. Yes." Kwan held her gaze. "Obstruction, retaliation against whistleblowers, wrongful termination with fraudulent documentation. Those are separate charges from the procurement fraud. They carry separate weight." The room was quiet for a moment. "Elaine Hargrove," Olivia said, in a cooperation interview. "She's providing information in exchange for considerations I'm not at liberty to share." Kwan's tone was neutral. "What I can tell you is that the cooperation doesn't reduce the charges. It shapes the sentencing recommendation. She still faces federal charges." "Richard Voss?" "Not cooperating." Kwan said it without editorializing. "His attorney arrived at 2:15. He's exercising his right to remain silent, which is his right. The evidence doesn't particularly need his cooperation." "Marcus Webb?" "Cooperating extensively." Something crossed her face that wasn't quite satisfaction, but was adjacent to it. Webb turns out to have been meticulous. He kept records, not because he intended to cooperate. He kept records because people who manage complex financial fraud often do, as insurance against their own partners. The records are comprehensive. He was covering himself in case someone above him tried to make him the only fall guy. Exactly. And the irony is that those records are now the most complete documentation we have of the network above him. Kwan opened a folder. Which is why I said earlier that the USB drive was useful but partial. Webb's records, combined with the drive, combined with the photographs your IT team recovered from the attachment server, give us a case that, she chose the word carefully, has substantially fewer holes than it had this morning. Olivia thought of the photographs, the time-stamped images of empty supply bins, the invoice with the signature. Someone had stood in a supply closet 3 weeks ago and methodically documented everything they could see and filed it in a system they believed was secure. And then the entry had been wiped, and they might have thought it was gone, and they'd had no way to know it wasn't. The person who filed the complaint 3 weeks ago, she said. The one with the photographs. Have you identified them? Kwan looked at her for a moment. Perry recovered the metadata from the entry. The staff ID traced to a nurse who resigned 11 days ago after what appears to have been a coordinated pressure campaign, informal complaints from management, schedule disruptions, a formal warning about documentation that, like yours, was not based on actual incidents. 11 days ago. So whoever it was, they'd gone through the same thing Olivia had gone through today, but slower, a grinding attrition instead of a single morning meeting, and they'd documented everything they could before they left, and then they'd been gone and hadn't known whether anyone found it. Where are they now? We're locating them. We'll want a statement. Kwan paused. I'd like yours first, if you're willing. Today, while it's current. She said so. Toot. The statement took 90 minutes. She was thorough and she was specific and she didn't editorialize because she understood that what was useful was fact and sequence, not interpretation. She described the supply closet reorganization, the pharmacy shortfall, the tone of her termination meeting, the specific language used. She described what she'd seen in the stairwell. She described the photograph she'd glimpsed through the records room door before the woman closed the folder. Kwan's recorder ran the whole time. When they finished, Kwan walked her to the door and said, "One more thing, and this is outside my formal role." Olivia waited. "Colonel Taft told me something about your background. I don't have the specifics and I don't need them." She paused. "But I want you to understand that what happened here today, your decision to stay, to work on the patient, to report what you saw, to sit in this room for 90 minutes and give us everything you had, that's not incidental to this case. It may be the reason this case closes with the breadth it needs to close with." She looked at her steadily. "I've worked federal healthcare fraud for 16 years. The person on the inside who sees things and tells the truth instead of protecting themselves, that person is rarer than they should be. I want you to know that." Olivia held her gaze for a moment. Then she said, "I didn't tell the truth to protect the case. I told it because it was accurate." Kwan almost smiled again. "I know. That's why I said what I said." It was 4:47 when she came back down to the second floor and stopped by the nursing station on Ward C. The shift change was in progress. The evening crew coming in, the day staff giving handoffs, the particular overlap energy of two groups who were both simultaneously arriving and departing. The charge nurse on evenings was a man named Tom Okafor, who had been at Northbridge 12 years and who ran his shifts with a steadiness that Olivia had always respected. He looked up when she came to the station. "You're still here," he said. "Fourth time," she said. He studied her. "What are you going to do?" She leaned on the counter. "I don't know yet. I was terminated this morning. That's technically still the status. Word is that's being looked at. Word is right, but word isn't paperwork." He nodded slowly. "You want to do a handoff review while you're here? The overnight on C is going to be a short one." She looked at him. He was offering her work. Not out of sentiment. Tom Okafor didn't operate on sentiment, but because the floor needed the staff and she was standing there and she was competent, and the situation was what it was. "Sure," she said. She pulled up the charts. She was 40 minutes into it when Taft appeared at the nursing station. He looked like a man at the end of a long day, which was notable because he usually looked like a man in the middle of a day that had not yet decided to be long. "Solano wants to brief you," he said. "Full picture, whatever she can share." "Now?" "When you can. She's going to be here for a while." He paused. "Also, Reyes wants to talk to you again when he's more awake. He's got something he wants to say, and he keeps trying to stay conscious long enough to say it, and then failing." Tell him to sleep. I did. He said, and I'm quoting directly, I'll sleep when I'm dead, which given the day seems like an overcorrection. She almost laughed. The almost laugh surprised her. She hadn't expected it to be there. I'll go when I'm done here, she said. Taft turned to go. Then he stopped. He turned back and he looked at her with the expression he sometimes had, not quite commanding, not quite warm, something that sat between the two that she'd never been able to name. The commendation, he said. The paperwork is done. It's going up the chain today. She looked at him. You didn't tell me that was coming. No, he said, but it was. It's been coming for 8 years. He held her gaze. You earned it. You earned it before today. Today just made it, he chose the word, undeniable. He left. She stood at the nursing station for a moment with the chart open in front of her. Mrs. Garland had been discharged at noon, which she already knew. Harold Hayford had been moved to step down that afternoon. Bed 4 had a new patient, 62, admitted through the ER during the Code Silver chaos. Cardiac history, stable. She turned to the next chart. The briefing with Solano happened at 6:15 in the same conference room on 3. Solano had a different quality now, the compressed energy of someone whose situation had shifted from urgent to complex, which was not easier, but was at least different. She had a whiteboard behind her with names and connecting lines that she half turned to block with her body when Olivia came in, then apparently decided Olivia had earned the right to see it and moved aside. Olivia looked at the board. 17 names, as Solano had said, lines connecting them to 3 nodes. Northbridge, a supplier company called Viridian Medical Logistics, and a third node labeled simply with a number, a contract ID. The contract number, Olivia said, federal procurement contract, issued 18 months ago. It was the vehicle for the fraud, a legitimate contract that was then used to invoice supplies that were never delivered. Solano capped the marker. Webb's records show that Viridian was a shell with 1 legitimate supplier relationship and 4 ghost accounts. The ghost accounts invoiced the military contracts, collected payment, and moved the money through a series of transfers. She paused. Hargrove's signature on the invoices placed her as an authorizing agent for Northbridge's participation in the scheme. She knew what she was signing. She says she didn't understand the full scope. That's her cooperation position. Solano's tone was measured. The evidence doesn't entirely support that framing. What about Richard Voss? He's insulated. Webb handled the operational side. Voss stayed at a remove. His signature doesn't appear directly. But there's communication, emails, calendar entries that establish awareness. She looked at the board. We'll charge him. The question is the level of the charge. And above Webb? Solano was quiet for a moment. Viridian has principals. 2 of them. We have names now from the drive and from Webb's cooperation. One of them is outside my jurisdiction to discuss right now. She met Olivia's eyes. But the investigation is moving. Today's events accelerated things significantly. The network is aware that we have Webb and the drive and the photographs, and that awareness is producing, in some of the other names on this list, a strong motivation to get ahead of what's coming. People calling lawyers. People calling lawyers, Solano confirmed, and in some cases calling us first. She folded her arms. I've been doing this for 11 years. When the defendants start moving faster than the investigation, it means the case is solid. Olivia looked at the whiteboard, the connecting lines, the names, the 3 nodes. $40 million, 11 facilities. Supplies that were supposed to go to soldiers in the field and went instead into a financial structure so elaborate that it had taken 14 months and a helicopter crash to make it visible. She thought of Reyes in the ICU bed, the field dressings on his wounds when he'd arrived. Applied correctly, she'd noticed that. Applied by someone who knew what they were doing, someone who'd been trained to handle exactly that kind of injury with exactly what was on hand, no more. She thought of the supply bins in the photograph. Empty. Someone in the field, she said. Someone who needed supplies and didn't have them. Because of this. Is that... She stopped. Solano's face did something careful. It's part of the case. Yes. They stood in silence for a moment. Then Solano said in a tone that was businesslike and also not, "You're owed an apology from this institution, formally. That process will take time because institutions are slow, and this one has more pressing problems right now. But it will happen." She paused. "I want you to know that the record, your personnel file, the manufactured complaints, the termination documentation, it's been flagged. It's evidence now, not just a file, which means it will be examined, corrected, and preserved accurately." "Preserved accurately," Olivia said. "What happened to you this morning will be documented correctly as what it was." Solano looked at her directly. "That matters." "Yes," Olivia said. "It does." She went to see Reyes at 7. He was more awake than he'd been in the afternoon, alert enough to have been arguing with the nursing staff about something. She could tell by the way the ICU nurse gave her a look of measured relief when she arrived. She sat in the chair. "How's the pain?" she said. "Better?" He was lying. She noted it. "What did you want to tell me?" He turned his head to look at her directly. In better light, with more color than he'd had at 1 in the afternoon, he was readable. A face that didn't perform much, that showed what it showed without extra. "I knew about the investigation at this facility," he said. "I told you that. What I didn't tell you is that I knew about your termination. Not before it happened. I found out at 0940, when our intel team flagged an administrative action at Northbridge consistent with the network's pattern." He paused. "At that point, the bird was already on approach, and the mechanical failure was already happening. There was no time to do anything except what we did. You couldn't have known the failure was going to happen." "No. But I want you to understand, if I had known earlier, we would have moved on this building before they had a chance to come after you." He said it without apology, because the apology was already built into the statement. "We should have been closer." She looked at him. He was carrying something, not guilt exactly, closer to the specific weight that came from understanding a chain of events and seeing exactly where a different decision would have produced a different outcome. She recognized it. She carried similar weight from other chains of events, other calculations. "You were working the broader operation," she said. "One termination at one facility wasn't the priority." "You weren't one termination, you were—" He stopped. "What?" He was quiet for a moment. "When I heard you were here, at this specific facility, I had a feeling, operationally you developed something. Not intuition exactly, a read on a situation." He shifted. "I thought, if Olivia Bennett is in a building where this network is operating and she's been there for 4 years paying attention and they just figured that out, they're going to try to remove her, and whatever she's observed without even knowing she was observing it is going to matter. And I was right." He held her gaze. "You saved my life today. Twice, by different calculations. And you handed the investigation the photographs and the database fragments and the timeline of what you saw on 3. He paused. "I wanted you to know that I know that, not from a position of debt, as a matter of record." She sat with that. As a matter of record. He'd chosen those words specifically, which meant he knew something about how she processed things. He probably did. "Sleep," she said. I know. I mean it. I know you mean it." He closed his eyes, then, after a moment, with his eyes still closed, "They're going to clear you, formally. Reinstatement and the rest. Kwan's putting it in the federal recommendations." A pause. "I thought you should know." She sat there a little longer. Then she stood and she went to the door and she was almost through it when she heard him say quietly, "Bennett." She looked back. "Tomorrow morning," he said. "Early. Before rounds. Come back." His eyes opened slightly. "Taft has something to give you. He wanted to do it officially, with people around. I told him you'd probably prefer it quiet." He studied her. "I was right about that, wasn't I?" She looked at him for a moment. "Yeah," she said. "You were." She walked out into the corridor. The building was in the process of becoming a different version of itself. The administrative floor processing the aftermath of what had been found, The investigative teams doing the long work of documentation and interview, the clinical floors running on the rhythm that clinical floors always ran on regardless of what was happening in the offices above them. Patients in beds. Monitors running. The night shift finding its pace. She walked to the elevator, pressed the button, waited. The doors opened. Inside the elevator, standing alone, was Sandra Welk, Richard Voss's administrative assistant. She was still in her work clothes, but her eyes were red-rimmed in the way of someone who had been crying and stopped and was now maintaining a surface. She was holding her bag with both hands. She saw Olivia and flinched, not from fear, from something more complex than fear. The particular expression of a person who understands standing in front of someone they have wronged by proximity, even if not by choice, that there is nothing adequate to say. Olivia stepped into the elevator. They stood side by side as the doors closed. "I didn't know," Sandra said. Her voice was very quiet. "What they were doing. I just processed what he gave me. I scheduled his meetings. I sent his emails." She stopped. "I didn't ask questions." Olivia looked at the floor numbers changing above the door. "I know," she said. "I should have, probably." She paused. "But it's hard to ask questions when the person you're asking is the one with all the power." Sandra didn't say anything after that. The elevator reached the ground floor. The doors opened. Olivia stepped out. The lobby was quieter than it had been at peak code silver, but not quiet. There was still the residual traffic of an institution that had had a significant day. Through the main doors, she could see the camera lights outside, the small cluster of press at the perimeter. A hospital spokesperson she didn't recognize was at the entrance, saying words she couldn't hear through the glass. She went back to Ward C. She picked up the chart she'd put down 2 hours ago and finished the review. She caught a discrepancy in a medication order for the new patient in bed 4. The attending had written 1 dose, the pharmacy had processed a slightly different one, small enough that it might have been fine and specific enough that it wasn't worth finding out. She flagged it. She called the attending. She got it corrected. She worked. At 9:45, Cass found her again. The younger nurse had the look of someone who had been processing the day's events in real time and had arrived at a place adjacent to overwhelmed. "They're saying there were 6 facilities," Cass said. "That's what's on the news." 11, Olivia said. Cass stared. 11 hospitals? Across 4 states. That's what I understand. She marked something in the chart. It's been going on for a while. And Webb he was here the whole time. Yes. Cass was quiet for a moment. How did you know? That something was wrong? Olivia looked up from the chart. I didn't know. I noticed things. There's a difference. Knowing requires certainty. Noticing just requires paying attention. But you paid attention. It's what I do. She closed the chart. Go finish your handoff. You've got 2 hours left on shift. Cass started to leave, then she stopped. Olivia, for what it's worth, everyone on this floor, we know what happened this morning and what happened after. We know. Olivia looked at her. 23, 3 months in, red-eyed from a long day, trying to say something that mattered with the vocabulary she had available. Thank you, Olivia said, and she meant it, even though she wasn't sure what exactly to do with it. Cass left. Olivia stood at the nursing station. It was almost 10. She should go home. She'd been in this building for 15 hours. Her back hurt in the low way that meant she'd been standing on hard floors for too long. She was out of good coffee and had moved on to the vending machine option 2 hours ago, which was a form of institutional self-punishment she'd inflicted on herself many times. She pulled out her phone. There was a message from Taft. Legal counsel for Northbridge reached out to Kwan's office at 8:30. They're preparing a formal retraction of the termination. Paperwork tomorrow. And below it, from the number she didn't have stored, tomorrow, 700. Taft. Rhea's floor. Don't be late. She stared at the screen for a moment. Then she sent back. I won't be. She put on her coat. She gathered her things. She walked to the elevator, and she pressed the button, and she waited. And while she waited, she looked at the corridor around her. The nursing station with its monitors, the supply cart near the wall, The door to Ward C, where through the small window she could see the general activity of a floor at night. The elevator came. She stepped in, and her phone rang. She looked at the screen. A number she didn't recognize, different from the unidentified one. Area code she didn't know. She answered it. "Is this Olivia Bennett?" The voice was male, careful, slightly formal. Not military. Something else. "Yes?" "My name is Hal Greer. I'm an attorney. I represent the estate of a former employee of Northbridge Medical Center, a man named Dennis Rourke, who resigned 11 months ago under circumstances I believe you may now be in a position to understand." A pause. "Mr. Rourke died 4 months ago. Cardiac event. He was 44 years old." Another pause. "Before he died, he asked me to contact you specifically if the situation at Northbridge ever became public." The attorney's voice was careful. "He said you were the only person in that building who ever looked at him like he was telling the truth." The elevator doors opened on the ground floor. Olivia stood very still. "He filed a complaint," she said. "Supply irregularities. About 18 months ago." 22 months ago, the attorney said. "He filed it twice. The second time with photographs." The photographs. The attachment server. The entry with the corrupted name field. "The name field was wiped from the database," she said slowly, "but the metadata survived. We pulled a staff ID." "His ID, yes." The attorney's voice had the quality of someone who had been carrying this for a long time and was finally in the act of putting it down. "He documented everything he could before they forced him out. He sent copies to me. He said he was very specific about this. He said the copies were insurance, that if he was right about what was happening, eventually someone would need to see them." She stepped out of the elevator. The lobby was nearly empty. Through the glass doors, she could see the camera lights still running outside. "He was right," she said. "Yes." The attorney paused. "I have 37 pages of documentation that he prepared. Itemized supply discrepancies, procurement records he photographed, internal communications he retained. He was..." The attorney stopped for a moment. "He was very thorough. He wanted it to matter." She stood in the lobby of Northbridge Medical Center at 10:17 at night, and she held the phone, and she thought about a man named Dennis Rourke, who had noticed things and written them down and been pushed out of his job and tried to make the truth matter, and then died at 44 before he could see whether it had worked. "Mr. Greer," she said, "I know who you need to talk to, tonight if possible." "That's why I called," he said. "Dennis told me, if it ever breaks open, call Olivia Bennett first. She'll know what to do." She looked through the glass doors at the camera lights. "He was right about that too," she said. She called Solano before she called a cab. Solano answered on the second ring and said nothing for 3 seconds after Olivia finished summarizing, which was Solano's version of significant reaction. Then she said, "Send me the attorney's number." And that was the end of the conversation. And Olivia stood in the empty lobby and did exactly that. Then she went home. She didn't sleep well. She hadn't expected to. The weeks that followed were not cinematic. That was the thing nobody accounted for. The justice, when it actually arrived mostly as paperwork. As depositions and federal filings and HR processes that moved at the speed of institutions, which was slow, which was frustrating, which was also the only speed at which things that were meant to last could actually move. Richard Voss was charged with federal procurement fraud, conspiracy, and retaliation against whistleblowers. He did not cooperate. His attorney issued a statement describing the charges as politically motivated, which the evidence made difficult to sustain. The trial date was set for 8 months out. Marcus Webb pled guilty to 7 counts and received a reduced sentence in exchange for the full scope of his cooperation, which turned out to be more extensive than anyone had anticipated. He named the 2 principals of Viridian Medical Logistics. Both were arrested within the same week, in different states, by different federal teams coordinating off the same briefing document. One of them was a former hospital systems administrator with contracts across 3 federal agencies. The other was a logistics consultant who had never worked in healthcare in any official capacity, which was, Solano told Olivia in a brief phone call, approximately what she'd expected. Elaine Hargrove was charged with 2 federal counts. She did not receive the lenient consideration she'd hoped for from her cooperation, because her cooperation, while useful, had been incomplete in ways that prosecutors described as deliberate. She lost her nursing license before the trial began. She did not fight that part. Dale First was found in a motel outside Harrisburg, Pennsylvania, 11 days after the helicopter crash. He had the USB drive, or had had it, before he'd destroyed it, which turned out not to matter because Webb's records had contained everything on it and more. Dennis Rourke's 37 pages of documentation became, in the language of the federal case, Exhibit 44. His attorney, Hal Greer, read a statement at the preliminary hearing about the circumstances of his client's employment and termination and death. The courtroom was not empty when he read it. The local press had started paying attention by then, and the national press had started paying attention 3 days after that. And by the time the full scope of the 11-facility network became public record, there were cameras in positions that would have felt surreal to anyone who had been inside Northbridge Medical Center on the day a helicopter fell out of the sky and a nurse stood in a stairwell watching a man she'd just been told she was done with. The other staff who'd been pushed out, 5 of them, across the 18-month window Solano had identified, were located, interviewed, and included in the federal retaliation charges. 3 of them had moved to other facilities and rebuilt. 1 had left healthcare entirely. 1 was a pharmacy technician named Garrett, who had gone back to school and was, as of the filing date, midway through a degree in healthcare administration, which had a particular irony to it that he acknowledged in his statement and then didn't dwell on, because dwelling wasn't useful. The formal ceremony was held on a Tuesday. Olivia had specifically requested it not be held at Northbridge. The building was still processing its own institutional aftermath, new interim leadership finding its footing, and she didn't want the weight of the occasion to land there. It was held instead at a public hall in West Haven City that was used for municipal functions and that smelled faintly of old carpet and the previous week's civic meeting. It was not elegant. The chairs were folding. Someone had brought a coffee urn that ran out before the ceremony began. Taft was there in full dress uniform, which made the folding chairs look more incongruous, not less. Reyes was there, walking with a cane he was visibly unhappy about, moving with the particular determination of a man who had decided that the cane was temporary and intended to be correct about that. Solano was in the back row, in civilian clothes, looking like a person who had attended a large number of these and had developed a practice of experiencing them quietly. Quan presented the formal exoneration first. The language of it was precise and dry. Federal documentation always was. But the substance of it was that every adverse action in Olivia's employment record had been reviewed, found to be fraudulently generated, and expunged. The termination had no legal standing. The manufactured complaints had been formally identified as part of the retaliation scheme. Her personnel record, corrected, showed 4 years of employment with no adverse actions, and a commendation she hadn't known existed from a hospital-wide quality review 2 years ago in which a patient safety initiative she'd proposed had been quietly implemented without attribution. She'd wondered why the IV protocol on Ward C had changed. Now she knew. Then Taft stood up and read something from a document he'd been carrying for 8 years. The commendation from Kabbalah Province. The language was military and formal and specific in the way that such documents were specific. Names of personnel, dates, a description of conditions that was measured enough to still be striking. He read it without inflection and without performance, and the room was very quiet. When he finished, Reyes tried to stand up straighter than his cane allowed him to, and mostly succeeded. Olivia took the folded document from Taft's hands. It was lighter than it should have been, for something that had taken 8 years. She didn't say much. She'd written something and then looked at it the night before and thrown it away and decided to say what was true instead. A man named Dennis Rourke noticed things, she said. He wrote them down. He tried to make them matter, and he was pushed out before he could see whether it worked. He was 44 years old. She paused. I didn't know him well, but he did the hardest thing, the thing that costs the most and returns the least, at least in the short run. He told the truth in a place designed to make telling the truth expensive. She held the document. This matters because of him. And the 5 other people who did the same thing and are sitting in this room or somewhere else trying to rebuild what was taken from them. I just happened to still be in the building when the walls came down. Nobody applauded right away. The kind of thing she'd said didn't produce immediate applause. It produced the quieter reaction of people deciding whether what they'd just heard was as true as it felt, and then landing on yes. Then Reyes started it, cane in one hand and the other moving, and the room followed. Afterward, in the parking lot, Cass found her. The younger nurse had come without being asked, which Olivia suspected meant Tom Okafor had quietly told the day shift about the time and location, which was characteristic of Tom. Cass looked like someone who had something prepared to say and had now lost it. "I don't know what I'm supposed to say," Cass admitted. "You don't have to say anything. I just—" She stopped, tried again. "I want to do what you do. The noticing things, the staying when it costs you. I don't know if I have that." Olivia looked at her, 23 with red-rimmed eyes for the second time in as many weeks, standing in a parking lot outside a civic hall in clothes she'd come directly from a morning shift to wear. "You drove here on your day off," Olivia said. Cass blinked. "Yeah. You already notice things. You just haven't needed to pay the cost yet." She paused. "When you do, and eventually you will, you'll find out what you have. Most people find out they have more than they thought." Cass stood with that for a moment, then quietly, "Did you always know what you had?" Olivia looked past her at the parking lot, the folded commendation in her hand. Reyes across the lot, talking to Taft, still overcorrecting against the cane. Solano getting into a dark car, already on her phone, already on to the next thing. "No," she said honestly. "I found out the same way you will, by being in the situation and discovering I wasn't going to leave." She said goodbye and walked to her car. She sat in it for a moment before starting the engine. The commendation was on the passenger seat. Her phone had 7 notifications she hadn't looked at. Juan's office, Greer, 2 from numbers she didn't recognize, and 1 from a Northbridge email address that turned out to be the interim director, formally offering reinstatement and asking when she was available to discuss the terms. She put her phone face down on the commendation. She thought about Ward C, Bed 4, the cardiac patient from Tuesday who was supposed to step down today. The IV protocol she'd proposed 2 years ago under someone else's name that was running in 3 departments now. Harold Hayford, who had eventually gotten his solid food. The supply closet on the 2nd floor that would be audited correctly by people who would keep the count. She thought about what it meant to do work that mattered without anyone knowing it mattered. To carry things quietly and pay attention and do the next necessary thing. She'd spent a long time believing that was enough. That the work was its own record. That visibility was irrelevant. She still mostly believed that. But she understood now, sitting in a parking lot in West Haven City with a document she'd earned in a desert on the other side of the world, that the record mattered too. That the truth of a thing, written down correctly and preserved where it couldn't be quietly removed, that was not the same as the work, but it was not separate from it either. Dennis Rourke had known that. He'd written 37 pages and given them to a lawyer and said, "If it ever breaks open, she'll know what to do." He'd been right. She picked up her phone. She typed a reply to the interim director. "Available Thursday, 8 a.m. My terms, not yours." She sent it. She started the car. The commendation sat on the passenger seat the whole drive home in the November afternoon light, folded and real and 8 years overdue. And Olivia Bennett, who had been dismissed and documented and fired and ignored and watched an investigation break open from the inside of a stairwell, drove through West Haven City and thought about Thursday. Not because the past didn't matter, because the next patient did.